Tyzzer disease in dogs, symptoms, causes, and treatments. If your dog is lethargic, has diarrhea, and has lumps near his liver, it is very likely that he has Tyzzer disease. While it is rare disease, it can still happen to a healthy and happy pup. You wouldn't want to see your canine with such deadly disease, right? So in this video, we will look at Tyzzer disease in dogs, all the problems, symptoms, causes, and treatments of this fatal disease will be discussed in this video. Stay tuned till the end of the video to find out more. About Tyzzer disease. As we begin this video, we need to know what Tyzzer disease is. This disease is a bacterial infection that is caused by intracellular bacteria of Clostridium pilliform. This type of disease is mainly transmitted through the ingestion of infected feces. This, in turn, colonizes the intestines and stomach, which affects the liver and heart. This bacterial parasite can cause severe damages to a dog. There are many reasons why a dog can receive this disease. One of the main reasons why this can happen is if a dog ingests infected meat. Apart from this, if the dog ingests the meat of a pregnant dog or unborn fetus, then there is a high chance for the dog to inherit this disease. This can be a very dangerous disease for your dogs, so stay tuned to find out if your dog may have any symptoms of this fatal disease. Symptoms of Tyzzer disease. The first thing you need to know about this disease is that it affects healthy and young animals when they undergo stress. The major symptoms can occur a week after the dog may have infected this disease. Some of the common symptoms can include watery diarrhea, coarse or ruffled fur, loss of appetite, fever, jaundice, lethargy, excessive urination, excessive thirst, abdominal pain, abdominal swelling, anal bleeding, convulsions, coma, and sudden death. The microscopic organisms go through the digestive tract and can arrive at the liver, where it can bring about genuine complexities. For the most part, more youthful dogs have the most noteworthy danger, and the infection can end up being dangerous in a terrible number of cases. If you see signs that your pet dog may be experiencing contamination, then at that point, you should counsel your veterinarian for a legitimate finding and course of treatment. This is what you should think about the side effects, causes, and medicines of Tyzzer sickness in dogs. Causes of Tyzzer disease. As mentioned before, Tyzzer disease is caused by Clostridium pilliform. The isolates available in this bacteria produce toxins that increase virulence. However, there are even a few isolates without toxins of the bacteria that can cause the disease to flare up. To diagnose this disease, the veterinarian will ask the dog owner about the full history of the animal. The doctor will take a general physical exam of the dog and will take a look for any abdominal pain or swelling on the animal. Apart from this, the doctor will even look at any pain that the dog might be undergoing on the lymph nodes. The symptoms of this disease can be seen through a complete blood count, urinalysis, and by doing a biochemistry profile. The doctors will even do certain blood tests for antibodies that can reveal whether or not the dog has Tyzzer disease. However, this book test cannot always be reliable in the case of Clostridium pilliform. Apart from this, the doctor may even take fecal samples that can give results of this fatal disease, which will show evidence of spores or parasites. This disease is acute but can become worse over time, hence it is important to treat the disease at the first stage. You need to keep in mind the final diagnosis may not be decided until and unless a necropsy is performed. When a necropsy is performed, the doctor may find inflammation, and necrotic tissue is the lower digestive part of the animal, which is available near the liver. Treatments of Tyzzer disease. Every dog owner wants the best treatment for their dog. However, before that, we need to see the cause of this bacterial disease. One of the most important things that you need to know is that this disease is very rare but fatal. This disease has had much scientific research in the laboratory. There have been cases that have been reported about this disease in North America. These areas include Wyoming, Wisconsin, Saskatchewan, Oregon, Ontario, Ohio, Montana, Michigan, Maryland, Manitoba, Iowa, Idaho, Connecticut, and British Columbia. The infection has been accounted for in the United States, Canada, South Africa, England, and Australia. Tyzzer infection in an animal happens when the bacterium Clostridium piriformis enters an animal's body. This normally happens when an animal ingests tainted excrement time, and again, a dog can likewise foster the infection by burning through the based meat. As a rule, more youthful dogs have the most noteworthy danger of getting the sickness, particularly in the case they are going through an unpleasant circumstances. Tyzzer sickness ought to be considered as differential analysis for foals somewhere in the range of 7 and 42 days old, enough with viable clinical signs and research facility proof of hepatitis. Unfortunately, the prognosis is not good for dogs who develop Tyzer's disease. Tyzzer bacteria are resistant to many of the antibiotics, and even with early treatment under ideal conditions, death can occur as early as 48 hours. Tetracycline and penicillin have some effect on the disease if given early enough, but under ideal conditions, the effectiveness is sporadic. Supportive treatments such as intravenous fluids to prevent dehydration is essential to give the patient the best chance of survival. Since the most common vector of transmission is the ingestion of infected feces, it is important to know what the dog eats or collects in the mouth, especially in areas where outbreaks have occurred. Stress in very young animals also seem to be predisposed to developing symptoms of Tyzzer disease, and extreme vigilance is recommended if the dog is still in the puppy stage or is under unusual stress. Recovery of Tyzzer disease. If your dog has gone through this painful disease, then recovery can take a lot of time. The recovery of the bacterial infection takes a long time for dogs. If your dog is reacting to antibiotics, the best thing you can do to protect their health is to make sure your pet gets the full measure of their antibiotic medication. Keeping the recovery patient in a calm and peaceful environment will help speed their recovery, as they will have food and water within reach of your pet. It is important to keep other pets in the house away from all points of infection, but Tyzzer does not pose a direct risk to human health. Frequent hand washing and cleaning the environment will help prevent the spread of disease. The rapid elimination of stool should be observed, and sterilization of any superficial stool. Observing the degree of liver compounds can be key in diagnosing the infection. At the hour of composing, there is tragically no known solution for this infection in canines. Affirmed cases can end lethally, and demise can happen within a brief time frame. The sickness has ended up being impervious to the most antimicrobials used to attempt to battle it. As a general rule, the best precautionary measure to take is to guarantee that your canine avoids the defecation of different canines. And watch out for nearby pet news reports for insights concerning episodes of this sickness nearby. Has your pet at any point created Tyzzer illness? What do your vet recommend for this treatment? Fill us in regarding it in the remarks beneath. If your dog has Tyzzer disease, the biochemical profile test may reveal abnormally high levels of liver enzymes, especially just before the dog's condition becomes serious. As we come to the end of the video, we can see the symptoms, causes, and treatments of the disease. Hope this video gave you the information that you were looking for. This is pretty much it for this video. We hope that you liked it. Thanks for watching, and we will see you in the next one.